Already giving you the vibes. Yes, we are just about to celebrate one of the biggest occasions, and just to remind ourselves when the Son of Man became the Son of Man so that he would make us sons of man to be sons of God. It will be Christmas soon, and so let's celebrate the coming of salvation into this world. That's music from Jeremy Sita featuring Ruben Kigame, Mokonzi Abotami, Mfalme Amezaliwa. It's coming up to 25 minutes to 8 o'clock, and thank you so much for joining us here on Breath of Heaven. It is Thursday edition of the program. So grateful for this opportunity to be able to learn, and as we learn, we grow. We be better people, health-wise and in other spheres. We desire to be better people, and every fourth Thursday of the month, we usually have a doctor from Cure International Kijabe, AICQ International Kijabe, talk to us about the health of our bones. And so tonight, I have the honor and privilege of hosting a doctor. Yes, from there, he's she is an orthopedic surgeon. You know, most of the times I've been hosting a male doctor, so this time round, I have a female doctor. Her name is Dr. Chelsea Shikuku. Welcome to the studio.
Thank you very much.
How have you been?
I've been good.
Mm-hmm.
It's a good day.
Mm-hmm.
It's a lovely season.
Yeah.
We're celebrating. So all is well.
Mm-hmm.
Yeah.
How are the rest of the family at AICQ?
They're all doing well.
Mm-hmm.
We work with children, so we're always joyful spirits.
Mm-hmm.
They feel us every day. Everybody's doing great.
Mm-hmm.
We're serving the Lord. All is well.
Mm-hmm.
Very grateful. It's a season of gratitude.
You're right.
Yeah.
That's right. And as we give thanks to God, we give thanks to God for life itself and the health that He has given us. And so, as I gave you as part of the introduction there, tonight we're going to have a conversation revolving around a certain syndrome. I hope I pronounce it right. I don't know if it's PSOAS syndrome or what, but Daktari will help us get a better understanding of this. And then we also welcome you. If you have a question or a comment, what you need to do is always ask by sending that question to 20933 or on WhatsApp 0717400555. And so, Daktari, you can tell us, did I get it right? Or nimeuma nje?
Matter of fact, you did. It is called PSOAS syndrome.
All right.
Are you sure you did not Google the right pronunciation for it before this session?
I assumed because P and the S follow each other,
Right.
the P should be silent.
Yes.
So let's get to know more about this. What's PSOAS syndrome?
So PSOAS syndrome is a rare injury of a muscle in the body that we call the iliopsoas. So we'll start from the beginning. Who is the iliopsoas and where are they located and what do they do?
That's right.
So the iliopsoas is a combination of two muscles, the iliacus and the psoas muscle. The psoas muscle starts from the back of the spine, and then the iliacus muscle starts from the inner side of the pelvis, and both of them join and come to the proximal part of the femur, which is the thigh bone. So you have two muscles that join to become one in the insertion to form the iliopsoas muscle. So when you have injury to that muscle, that's what we call the PSOAS syndrome. The action for this muscle, because then that will help us to know how people with PSOAS syndrome present, helps with flexing the hip, which means an anterior bending of the hip. So if you're moving, say, from like a seated position to go up, that's the muscle that's involved with that. It can also help to move your leg out, which is an external rotation. So those are the functions. That's what it is, where it comes from, where it goes, and what it does. Yeah. So when you have a PSOAS syndrome, you have irritation or inflammation of the psoas muscle. Yeah. So there are different things that could cause it. Sometimes it's overuse, that we're using the muscle. This is important in athletes, especially adolescents and young athletes, because they're overusing this muscle in the activities. Some people even call it like a jumper's or a dancer's disease or injury, because during this sport activities and during dancing, they're commonly using the iliopsoas. So as you use it, it could get inflamed or stretched out or get some form of trauma. The other time when we see it is if it's irritated by while you're having surgery.
All right.
I'll break this down.
Mm-hmm. Mm-hmm.
So in patients who have hip arthritis, in the late stages, we consider hip replacements. So sometimes when you replace the hip, the cup side of the hip, if that side is big, then because the psoas muscle passes over it, it can get irritated as you're doing this. That's one thing. Some of the hip replacements, we use screws to hold it. So if the screw is long, it can also irritate the muscle. So a lot of this causes, whether due to overuse, due to activity, or if you have had a surgery before and it's irritating the muscle, it would get inflamed, and that's how you get the psoas syndrome. The people who are at higher risk of getting it would be athletes, as we said, and dancers because of activity, but also people with arthritic, especially things like rheumatoid arthritis, because we know generally these people would have inflammation around the joints. Yeah, so those would be people who would commonly get it compared to the rest of the general population. Gender also plays a role, and it's twofold, because then a lot of these inflammatory arthropathies like rheumatoid arthritis would commonly affect female more than male. So even with the psoas syndrome, we tend to see it more in the females than we see it in male. So that's a general outline of what the psoas syndrome is. How people present with it, I think that would be the next step. They typically complain of pain around the pelvic area, the groin, but because of nerve supply, that can move down to the knee, because you have some nerves that supply sensation around the hip, and they also supply sensation around the knee. So sometimes you can have what we call referred pain. So it's pain that's starting from around the pelvic area, but because of the nerve supply, you can feel it somewhere else. Then they would sometimes complain of a snapping or a pop. Say if it's inflamed and it's gotten big and you're moving the hip and it gets irritated, especially the ones who are post-surgery. They could also complain of back pain. Remember, we said that this muscle starts from the lower back. So sometimes if the irritation is all the way up from its origin, these patients could present with back pain that's going down, radiating down into the area where you sit, which is the sacrum, and the groin area, as we said before. It seems to get worse with activity and relieved by rest. Remember, this is a muscle that's inflamed, so the more you use it, the more symptomatic it is, as opposed to the people who are, when you relax and you're resting, and it's not as painful then. So it's exacerbated by activity, especially when you're changing position. Say if you're moving up from a chair, remember you're using the muscle then, or if you're moving from a sitting position to a standing position, or difficulty when you need to stand upright. So going upstairs, any activity that requires moving from a sort of seated position to a standing position would make the pain worse. So when we're examining, or when you see a doctor, they'll watch you walk in. Sometimes you'll have a limp. And then you can actually try and feel if they have more pain at the area in the proximal thigh where the muscle attaches. And then where we move the joint, sometimes you can feel a snap as it's moving around, especially when the leg is bent and rotated outwards. It's important to know that there are certain other things that could present the same way. Which brings me to the next step of how do we differentiate between all these other things that could present with back pain, going down to the leg, pelvic pain. So we use, once you've examined, you can use imaging to sort of differentiate and narrow down to exactly what the pathology is. So x-rays are not very helpful because x-rays typically show you the bony anatomy. Remember, here we're dealing with a muscle that's inflamed. But say if you've had surgery and we think the snap and the pop and the irritation is from that, then doing an X-ray to see how the joint replacement is doing could help and make you think that maybe the long screw is the one that's causing irritation, which is explaining the symptoms. But it wouldn't necessarily tell you that the muscle is irritated and inflamed. Another useful investigation is an ultrasound. So then the ultrasound can show you areas of inflammation around the muscle. You could also use it to put in a numbing medication and a local anesthetic. That's important in two ways. It's important because if you inject a local anesthetic to around the muscle and the pain goes away, then it tells you that that truly was a problem. But then also if you had it and you get relief, then it's also treated the symptoms of what you're presenting with. So we can use it for diagnosis or you can use it for treatment if it's truly the same. You could also do an MRI. We're getting more complicated and more expensive, of course, and more bigger investigations.
Yes.
And that would give you an idea of what the anatomy and if there's any inflammation around the muscle. So the other things to be aware of that could also present the same way is, we'll start from the back and work our way down. So in the back, if you have a disc is the shock absorber that sits in between the bones in the spine. So if that shifts, what we call a herniated disc, and it's pinching onto a nerve, then you typically have the same thing. So you have back pain that's going down the leg, depending on what level the nerve has been pinched. Then there are things in the stomach that could also present the same way. So say a patient has an inflamed appendix, an appendicitis. The appendix sits just over the psoas muscle. So if you have inflammation of the appendix, then it could also cause inflammation of the psoas muscle. And so sometimes patients with appendicitis could present the same way. The same thing applies for diverticulitis, where you have an outpouching of the intestines. If it's close to the area where you're having the psoas muscle, then that could also present the same way. The other thing would be a kidney stone. Now, the location is important with this because it has to be around the iliopsoas area. So you can have kidney stones at different levels, up in the kidney, in the ureter, which is a connection between the kidneys and the bladder, which stores the urine before we pee. So if you have a stone that's lodged into the ureter, then these are patients who could present the same way. Once you've ruled out it's not all these other things and we figured out that it truly is a psoas syndrome, then how do we manage? I guess is the next step. So most patients with psoas syndrome would respond to non-operative managements. So that would be the first step. Non-operative managements could start with just physiotherapy exercises. You could consider using anti-inflammatory drugs and observe and see if there's response with that. For patients who are athletes or who are high activity users of the muscle, then you could consider a rest period to allow the inflammation to go down before resuming normal activities, whether sports, whether dancing. For some, it's even occupational. Their work just requires them to sit and stand all the time. If this does not work, then you could consider doing injections like I talked about. So ultrasound guided, because this is a deep-sitting muscle. It's not easily palpable. You cannot easily feel it from the outside. So a lot of times we'll use imaging to help with localizing where the muscle is. And you could use the local anesthetic like we did when we were investigating what it is. But you could also give a corticosteroid injection. Now, the corticosteroid just helps with reducing the inflammation, and by extension helps with the relief of symptoms. If you've tried all of these things and it's not worked, then there's a room for surgery. But most people would have a resolution of symptoms with just the non-operative treatment modalities. But sometimes that's not enough, and we have to consider surgery. So if it's secondary to something, say a screw is long or the cup is big, then you would replace that. But sometimes it's just inflammation and you don't know exactly what caused the inflammation. So what can be done is with now we have arthroscopic surgeries where you use small incisions and put in cameras into the hip area and around that area, and you can release the muscle from where it attaches on the proximal part of the femur. Again, this is like the last option if it's not responsive, and a very small percentage need to have procedure for this. As I said, the prognosis is good. Majority will resolve with just medication alone without needing surgery, but it's important to know that some will not get relief with that, and then would then go ahead to have surgical intervention for it. Yeah.
Well,
a mouthful.
Yeah, but you've given us a journey there from the diagnosis. In fact, you've just given us a definition and then the diagnosis when the patient comes to you in your practice to just give the symptoms and go ahead and look at the diagnosis. You also mentioned the issue of treatment. And so somebody may ask, is there a typical treatment timeline for PSOAS syndrome, especially after having done the diagnosis and gone through all the various procedures?
Yeah, not quite, because a lot of this depends on how the body responds. In terms of athletes would typically give a resting period of about 6 to 8 weeks, and usually that's enough time for the symptoms to resolve. So you're looking at a go-slow period of somewhere between a month and a half to 2.5 months on average. Of course, there's some who will respond quicker. There's some who will respond a bit slower and take a longer time for recovery. If you're getting to the stage where you need surgery, then the timeline of treatment prolongs even further. Yeah.
Are there any what you would call alternative or complementary therapies that might be helpful in managing PSOAS syndrome?
Yeah. So one other thing that has been used successfully is an ultrasound guided sonographic management, where you give rays onto the muscle, and that gives relaxation of the muscle, in addition to your physiotherapy and your rest and your anti-inflammatory medication. Yeah.
And so the issue, you've now mentioned the issue of medication. What role does medication play in the treatment of PSOAS syndrome?
So it's twofold. You have pain relief, because pain is what will bring somebody to the hospital to seek management. So you want proper pain control, but it also helps with reducing inflammation around the muscle. Remember, we said the primary issue with this particular syndrome is that you have inflammation around the muscle. So if you take things like brufen or acetaminophen, those have anti-inflammatory proponents in it. So that reduces the amount of inflammation, swelling around the muscle. And by doing that, you have a resolution in the symptoms. Yeah.
In case you're joining us right now, tonight we are hosting Dr. Chelsea from AICQ International Kijabe. And she's giving us a time of learning. You know, this is free consultation on air. Yeah, she's giving us information regarding PSOAS syndrome. Probably you've heard about it. Probably you've never heard about it. This is the night that you need to tune in and get to hear more about this. We're also live on Facebook as well as on YouTube. You can catch us there. And we remind you, always ask your question on 20933 on WhatsApp 0717400555. We'll be checking your messages in a little while, even as you get to share the issues that you are going through. And so in looking into more of these questions regarding PSOAS syndrome, I'd like to find out then, as we carry on, somebody you've talked about those people who are active, the athletes and all that, who are predisposed to this kind of syndrome. And so there's something that you would mention then regarding the preventive or even the lifestyle modifications that can help us avoid going that direction.
So I guess the biggest thing would be lifestyle control, The reason that's important is because in addition to activity, we said some of the inflammatory arthropathies and arthritis around the hip would predispose you to having this. So as we know, the background of this involves a lot of what we eat, how we exercise, our activity level in terms of exercising, so that's important. For the athletes, they will typically have team doctors who can advise in terms of not straining, the number of hours in a week that are okay to exercise, some of the stretching and strengthening exercises for the muscles around the hip, so that even as they use it, they're building power and resilience in the muscle, so that reduces the amount of injury that they get. So a lot of it will be collaborative with the team doctors, but for us who are not athletes and would just like to know how not to get this, a lot of this would be just lifestyle choices and our activity levels. Other than that, sometimes it just happens. And it's okay. There are many things in medicine that just happen. They're not secondary to anything that we're doing or not doing. So if it happens and we cannot pinpoint an exact cause for it, then we still manage it anyway. Yeah.
Right. Yeah. So in the next hour, we continue with this conversation with Dr. Chelsea, and we still invite you to tell somebody, and also go ahead and ask those questions. Will help us to learn better regarding this particular PSOAS syndrome. And so tonight, I also want to remind you, we are voting for our very own Man Karis, who was nominated in the Kibali Awards, and we are still having that opportunity to vote for him. So how to vote for him? You simply dial *70 *50 hash, that is *702 *50 hash, and enter contestant code 2836. And this is the last day, so ensure that vote goes ahead to make him be the top in this particular Kibali Awards. Online, you can vote for him, www.kibaliawards.com. Cast your vote now. Voting is now open.
Hi, this is Carol from the Celebration Choir. And you tuned into Breath of Heaven.
This is Breath of Heaven
on Hope FM.
On Hope FM.
Listen and live on 93.3 FM in Nairobi, 93.9 Western Kenya, and 101.9 Mombasa.
Hope FM exists to know God and make Him known through evangelism and discipleship. For feedback, suggestions, or complaints regarding our programming, talk to us on 0709 861180 or email us on feedback@hopefm.org. Reach us through our social media platforms at Hope FM Live. We would like to thank you, our listener, for your continued support. Hope FM. Listen and live.
Listen. Listen to God. Live with hope in your heart. Listen. Live with hope in your heart. This is Hope FM. Where you listen and live. Hope FM.
It's now 8 p.m.
Listen and live.
A revival is breaking out. The voice of hope in the air.
The stuff that life throws at us sometimes can be downright terrifying. Other times, it just seems to grind us down. Either way, what we really need is peace. Where, pray tell, do you find that? Hi, I'm Bernie Diamond, and welcome again to Fresh. When the stuff of life attacks the very fibre of your being, peace seems impossible to lay hold of. How can you have inner peace when your finances are crumbling, amidst a broken marriage, the tragedy of a wayward child, a devastating health prognosis? More often than not, we try to think our way through, turning the problem over and over in our minds, tossing and turning in the night. How well has that worked for you in the past? Here's God's take, His truth, His peace. Psalm 46, beginning at verse 1. God is our refuge and strength, a very present help in trouble. Therefore we will not fear, though the earth gives way, though the mountains be moved into the heart of the sea, though its waters roar and foam, though the mountains tremble at its swelling. Be still and know that I am God. I will be exalted among the nations. I will be exalted in the earth. The earth's giving way. The mountains are falling into the sea. The ocean's roaring. The ground's trembling beneath your feet. You don't find the solution to that on the internet. The place we need to be, you and I, the place of peace, isn't in escaping those circumstances, but right there in the stillness of the eye of the storm. Because that's where God is. Be still and know that I am God. I will be exalted among the nations. I will be exalted in the earth. That's His word, fresh for you today. When God speaks in that place, His stillness, His peace flood your heart. That's why I'd love to send you your fresh devotional every day. A powerful scripture verse together with some words of inspiration, hope and encouragement to help you be all that God made you to be. It's completely free. Just stop by at freshdevotional.org for instant access. That web address again is freshdevotional.org.
Rafiki soul is a promise of a hand that reaches and goes beyond watangaza tumaini kote.
Thank you for being a friend of hope. To donate, kindly use the M-Pesa paybill number 933933, account FOH.
When looking to buy a home, affordability and the surrounding areas are what you care about most. That's why Moke Gardens offers the perfect blend of value and serenity. Tune in to Activate every weekday morning from 6 a.m. to 9 a.m. for details about their upcoming affordable housing open day and how you can secure your place with flexible payment options. Moke Gardens, experience living.
We asked and you gave. By God's grace and through your generosity, we were able to purchase all equipment needed to broadcast hope and reach one more soul in the Camel region through the Rafiki Mso campaign phase 1. We are deeply grateful for your partnership. Because of you, the message of hope is spreading farther than we could ever go. Now, as we embark on this mission, we call upon you one more time to help us reach one more soul by becoming a friend of hope. Send your donation of any amount to the M-Pesa paybill number 933933, account FOH. Let's spread the light of hope one soul at a time. Wewe ni Rafiki Mso.
The
breakfast show that kickstarts your day with power and rejoicing.
God will catch up with them. Don't worry.
Set your alarm and grab a cup of coffee and let's make our morning memorable.
Sharon, you are the greatest project you'll ever work on.
Come on.
So you need to focus on yourself.
Hey.
Sisi wengine usituangalie sana. We can take care of our issues.
On Activate with Sharon and Favored Frank.
Ati God will not deliver me. Listen, devil.
He will.
He will. As a matter of fact.
Amen.
He is a shield around me.
Amen.
He is my glory.
Activate weekdays from 6 a.m.
Are you looking for an affordable yet peaceful place to call home? Moke Gardens makes owning your dream home possible with prices starting from just 1.5 million shillings. Join us on November 29th and 30th for Affordable Housing Open Day at our Lucania site in Athi River just off Mombasa Road. At Moke Gardens, you'll enjoy access to clean water, school amenities, and a quiet, serene environment all within easy reach of the city. Plus, our trusted partners like Boma Yangu, Kenya Mortgage Refinance Company, and Stanbic Bank are ready to help you get started. Don't let this opportunity slip by. Call 0720-697-360 or 0722-266-547 or visit www.moke.co.ke for more information. Moke Gardens. Experience living.
Breath of Heaven. Settle down to a night in God's presence with the most awesome praise and worship music.
Artist of the Week on Breath of Heaven.
It's so unusual, it's frightening.
I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better. And I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on Leadership Forum. Do they have a radio here? Never mind. I brought my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcasts?
Really? Even Miss of the What?
Yeah. I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website www.hopemediakenya.org. Listen and live.
I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better. And I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on Leadership Forum. Do they have a radio here? Never mind. I brought my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcasts?
Really? Even Miss of the What?
Yeah. I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website www.hopemediakenya.org. Listen and live.
I've I've actually been trying to find a balance. It's been really tough and hectic, but everyone says once you get a hang of it, it becomes better. And I don't know, but I'm hoping to find a balance soon because it's really been hectic. But you've been in the job industry for a long time, so I think you would know better, Sindio.
Huh? What time is it? I need to catch up on leadership forum. Do they have a radio here? Never mind. I broke my own.
No way. You can't be serious. Wait, why do you have a radio and you can just catch up with the shows on Hope FM podcasts?
Really? Even Miss of the What?
Yeah. I mean, you can find them on whatever platform, name it. AfriPods, Google Podcasts, Apple Podcasts, Spotify, you name it.
But I'm not subscribed on any of them.
Oh, no worries. You can just check out the latest episodes on hopemediakenya.org.
You can now listen to select Hope FM programs on your favorite podcast streaming platform or directly on our website, www.hopemediakenya.org. Listen and live.
Developing PSOAS syndrome.
So this is important for people who sit a lot. So if your work involves sitting, a lot of office work, you're seated most of the time. So this applies to you.
Like me, for example.
Like you, for example. But it also applies to also people who are on the move. That's what ergonomics is all about. It's about how we take care of ourselves in our day-to-day activities. It's a breakdown of the complicated English word. So if you're sitting a lot, remember we said this muscle starts from the spine. So the posture of how you sit is important. It starts with the type of chair that you have. So you want friendly postures of the back. Now the spine is typically not straight. The normal spine comes with curvatures, forward and back, and it's almost S-shaped as opposed to straight up. So you need a chair that almost replicates that particular anatomy of the back and does not force you to either sit completely straight and change the posture of your back or slouch forward, which is not how the normal spine sits, especially when we're seated or standing. The other thing is, if you have to sit almost all day, is taking breaks in between. I think you look at some reference and they'll say 30 minutes, which might not be practical because sometimes you're in a meeting and it goes over an hour or two. But the idea is to take breaks within the day to just stand up, walk around, grab a coffee, come back, sit down, stretch, walk about, as opposed to sitting all the time. The problem with sitting all the time is then you're not using muscles. And when you don't use muscles, they get weaker. When they get weaker, they're easily injured, easily irritated. So it's important to have that balance in life of where you have to do what you have to do to get your job done, but also remember to take breaks to make sure you're active and moving about. When it comes to the people who are active, so incorporating healthy exercise regimens is important. So having home exercise programs, warming up before you start your exercise, and cooling down once you end, to do stretches before and after, as opposed to just suddenly stretching out muscles. So coming up with a routine that involves warming up and cooling down after your exercise regimen. So I think for me, that's what, those are some of the easy, practical, day-to-day things that we can do or incorporate to what we're already doing that can improve, or rather prevent or reduce the rate of getting PSOAS syndrome. Yeah.
Would you discuss a bit on some of the practical exercises that you know would help somebody?
So, simple things that you could do is lie on your back and do a straight leg raise which means your knee is completely straight, you're not bending it, and you're pulling it up to the sky. Remember, this muscle helps with bending the knee forward. Yeah. So when you do that, then you're exercising the muscle. You could do this also on your side. So you lie to your side and you bring your knee forward or back and you stretch it out. Those are common exercises that you could incorporate. But also doing back and core strengthening exercises could help. So if you're lying on your back and bringing your knees to your chest, that helps with stretching out the back muscles, but it also helps with strengthening the gluteal muscles as you're exercising this. Yeah.
All right. And so I would like also to ask this. Beyond the posture and exercise, are there other lifestyle modifications that can help prevent this particular syndrome?
So diet is very important. Diet is important, so we need to have a balanced diet. A healthy plate has half of it being vegetables and fruits. I am guilty of this. I will not sit here and lie that I follow it as a hard fast rule, because that's just not how we were taught to eat. So we have vegetables and fruits, with a quarter of it being carbohydrates and a quarter of it being protein. Of course, depending on if you have other underlying diseases that you're managing, then this could change. But we're looking at a healthy, normal, balanced diet with proper hydration. Because diet impacts a lot of things in our bodies. It impacts how our muscles act. It impacts how our joints move. And the muscles help us with moving joints around. So when you're walking, standing, going upstairs, you're using the iliopsoas muscle. So anything that impacts how the muscle health is would then impact your susceptibility to getting this syndrome. Yeah.
All right. So in case you're joining us right now, we're still learning, and we're still learning more about the PSOAS syndrome. If you've never heard about it, tonight you have an opportunity to ask a question regarding the same. Probably you joined us as we were already going on with the program. Remember, we are also live on Facebook and on YouTube, Hope FM Live. You can catch up with us. And so we'll look at some of the questions. Thank you so much for all of you who are already commenting on Facebook. I see comments in the comment section. Albanas Mumo, as well as Martha Nyambura Samuel, Anthony Wasihendu, Carlson Omari Otondi, Bernard Maina, Lawrence Sudwar, as well as Christine Shikuku following us as we carry on. There is this question here. This is from a listener who says, hello, great job you're doing. Thank you. He's saying, kindly ask Daktari to speak on RLS, stroke tingling, and needles on the foreleg, stroke shin. Saying it is not related to diabetes and is usually prevalent in the evening when seated. Thanks and God bless you. Yeah. That's where the listener is at. Probably if you would like to comment on that.
So tingling could be two things. It could be from the nerve. Usually it's a nerve problem. It's a neuropathy problem. So sometimes it's an issue of compression from the back, like we said before. Or it could be something that's affecting the nerve itself, which then could give you the tingling. So the tingling is just an manifestation of a nerve problem. The first illustration would be a pinch of the nerve from the back. The reason that's important is the spinal cord then gives out the nerves that give us power and feeling to our bodies. And in the lower back, you have the nerves coming out to come and supply sensation, which is feeling, and movement to the muscles on the leg. So it could be from that. The other thing could be if you have underlying pathologies that predispose you to having nerve problems. And you mentioned one, which is diabetes. That is common to have neuropathic pain, which is that tingling sensation that you would feel around the leg. Sometimes it could be a nerve problem closer to where it's applying. So if it's pinched or constricted even lower than the back, then that could also give you tingling. Sometimes the back is fine, but then you have compression or you had trauma around it, then that could also present the same way. Yeah.
I see another question here from Eric, and saying, can you ask Daktari if there is something wrong with my back? Because whenever I stand for some time, my back gets really tired, and in brackets he indicates back pains. Could there be something wrong?
So back pains are a common problem. As an orthopedic surgeon, it's one of the most common concerns that patients come to see us with. Now, there are different things that could give you heaviness and that feeling of fatigue on the lower back. Some are mechanical. Mechanical just means there's something that is either being pressed or is not moving, or you have tight muscles in your back that's then giving you the pain. But some are non-mechanical. The beauty with low back pain is you have a significant percentage of people who would then respond to just pain medication and guided physiotherapy exercises. I know a lot of us in this time and they love to go to the gym, but that is not guided, and some of those could be strenuous to the back. What I would then advise is to see one of us, because then you can get a proper assessment of the back, and that can help differentiate. If you're dealing with something that's mechanical, that would need non-mechanical relief, or non-mechanical that would just respond to pain management with some active physiotherapy. Yeah, it becomes very difficult to say yes or no to your question without having done a proper full assessment. Yeah.
All right. And moving on, this one here is saying, my big problem is my left knee. I fell with a motorbike way back in 2013. I went to various hospitals for treatment, but till now, I always have experienced pains which have gone to my backbone. Yeah.
Okay. So the back, the hip, the knee, and the ankle are big joints that are involved in our movement and motion of the day-to-days. If you have injury to your knee, different times, could be a fracture, could be just a soft tissue injury, it then affects how you walk and your posture and puts more strain on the other joints to accommodate for the work that it would have done. So it's not unusual to have an injury on the leg, which then in the later period presents with adjacent joint problems and pain. Or sometimes it's not related at all. That you had one thing that was sorted out and then something else has come up. So it is possible that it could be associated, but it's also possible that it could be something completely different. Yeah.
All right. Here's another one who is asking, back in the year 2009, I had an issue with my knees, whereby I had a lot of pain in that I was facing difficulty when squatting.
Okay.
But now the pain is no more, but I now have some bone projection under both patellas. What could be the cause?
Okay. Yeah. So pain while squatting tells me there's some injury to the knee. It could be superficial, where the patella itself has a small fracture that heals some type of way, and maybe it wasn't healing quite well, and that would explain a bump. Or sometimes it could be something inside the knee itself. The same way we have shock absorbers in our spine in the back, we have similar, we call them meniscus, in the knee. So you could have different types of injuries. Again, as we said, usually we do a proper examination and do images to rule in and rule out what the primary cause of a symptom is. If there's a bony protrusion, starting off with an X-ray, would be able to tell us what the bony anatomy around the knee looks like, and then work from there. Yeah.
Right. And this one here is asking, Doctor, is weight loss using supplements or medicine safe for our health? And goes on to say, my backbone is spinning at the center whenever I carry 2 loads, probably like 2 jerry cans full of water on both hands. I feel like 2 parts brushing over the other. What could that be?
Okay.
Yeah.
So weight does play a role. And part of management of chronic back pain involves weight loss, because the heavier you are, and again, it's not subjective, it needs to be objective. So you'd need to get a proper BMI assessment where I would look at the height versus the weight, because then you have ideal weights for different heights. Once you have that in mind, it tells you where you are. Are you in the normal? Are you underweight? Are you on the overweight? Or are we on the obese side? Most people would be normal and slightly overweight, with some on the underweight side and some on the obese side in this part of the world that we're in. So if the person is overweight and obese, it means you're putting more stress on your joints. So the reason we advise that you lose weight is just so that you're reducing the amount of stress and load the joints are having to take. And enough research and from our experience has shown that losing weight actually does help with improving the symptoms. But we have to be objective about it. So getting a BMI assessment to tell you where you're at helps you with then having goals towards having a healthy weight for your height. So that's a good step. That's a good step for you to start. And then obviously, even as you do this, having healthy carrying, because even how we carry loads could impact how we feel on our backs. So healthy ways of carrying weights, healthy ways of how much weight we should carry is important on the day-to-day. Yeah.
And what would be the healthy way if somebody would ask? Probably they're doing it the wrong way.
Right.
So which would be the right way?
So you need to also bend your hip so that you're recruiting other muscles to do it. Sometimes you just go straight down and lift, and that puts a lot of stress on the back. So it's important to keep those things in mind and ask for help. I know I don't all the time, but it's important to ask for help so that you're not having to lift more than you have to. Yeah.
All right. We're learning more about the health of our bones and looking at your questions. Keep sending them to 20933, WhatsApp 0717 400 555. And you can also follow this broadcast on Hope FM Live on Facebook as well as on YouTube. Here's another question. 59-year-old. I've been having mild pain on my left shoulder for quite some years now, especially when I sleep. I sleep on my left side. I used to carry a small bag often. What could be the problem, and which is the best sleeping position?
Okay.
Yeah, those are the questions.
So at that age with shoulder pain, it's common to get irritation around the shoulder joint. Either because we have the muscles that help us with lifting and doing overhead activities. Say if you need to comb your hair, you need to get a cup off a shelf, the muscles just go over the shoulder joint. And sometimes if that is pressed upon or it's inflamed, then you could have pain around the shoulder. But just like age, our joints also age. So the more years you have on your book, which is God's blessing, the more they age, the joints also age. So it could be a mild version of that too. In terms of sleeping posture, you want to offload the side that's symptomatic to begin with, and consider, like lying face up, lying face down, lying over the other shoulder. But also shoulder strengthening exercises could help with building the strength of the muscles, even on the shoulder that's symptomatic. Of course, if then that does not go away, it's important to see an orthopedic surgeon for them to do a proper exam and proper investigation to make sure you don't need more than just home adaptations to your pain. Yeah.
You're getting help here. Yes, and I see another question from our listener saying, I was diagnosed with osteoporosis years ago after being earlier diagnosed with multiple sclerosis.
Multiple sclerosis. Yep.
Doctor, will the condition get better? I am 34. I'm 34, yeah.
Okay. So with multiple sclerosis, it's one of those conditions that we do not have a definitive treatment for. What I mean is we don't have something that will completely remove it from your body. So a lot of the management and treatment involves helping to calm down the symptoms that you have. You have a good number of people who are at the point where the symptoms are well controlled, that they're able to live a near normal activity level. So it's just important to know that we're managing the symptoms, because then we don't have a treatment that is known yet that can completely resolve the condition. But you could have medications that can help with keeping it in a manageable state. So that's what we recommend. And my hope is that you have a doctor who's following you up, who's able to advise on what needs to be done and what medications you need to have to keep it well controlled. Yeah.
Right. This one here says, I had a CS in 2011 using spinal anesthesia, and I usually have sharp sudden pain during a strenuous day, which feels like some electrical shock on my lower back. This lasts for 1 to 3 seconds, then it's over. Do I need to worry, though my job involves a lot of lifting and moving patients?
Okay. So maybe I should explain some of the red flags with low back pain. Red flags means the things that we look out for that worry us, and hopefully this can help you with deciding if it's something that you need further medical advice on. So if the pain wakes you up at night, so night pain strong enough to wake you up at night, that's a red flag. If you have associated difficulty controlling your bowel and stool, the reason that is important is, again, we say the spinal cord gives you power and sensation. So if you have that, then it's something we need to be concerned about. And then if you have tingling sensation around the groin area, the perineal area, this is where you pee, and the reproductive area, we call that saddle anesthesia, is another red flag that we need to be worried about. Associated weight loss with this is also one to think about. So hopefully these are things you could assess and see. And if you have sudden change in your weakness or strength on your lower limbs, you're able to move, and then all of a sudden you feel some weakness on your leg and you're not able to move, that's also a red flag that we look out for. As I said, low back pain is a common thing we see as orthopedic surgeons. The beauty is most of them are managed even after seeing us with conservative treatment. So now that you have work that involves lifting a lot of objects and heavy loads, so healthy, again, as I said, healthy ways of lifting and managing the load that you lift every day. Again, I know sometimes that is difficult depending on the job that you have, but just being aware that some of these things and choices could then affect how you feel at the end of the day. Yeah.
Right. Moving on, there is this one here, says, I don't know if it is sleep paralysis, but several times I have woken up and I can't feel my leg. I can't feel my leg from knee downwards. When I try to stand, I feel uncomfortable until after some times. And most of the time, I wake up lying on my back. Should I be worried? Mostly, it starts like I'm in a dream and I'm paralyzed from the same leg. And I don't know if it's all in my mind or all in the mind.
I think now that it's something that's worrying you enough, it's worth investigating a bit more. Because then it could be something underlying, as we said, because the nerves from the back, again, are common culprits for giving numbness and weakness. And just as I said earlier, having weakness is one of the red flags, one of the things that we look out for. So seeing an orthopedic surgeon and investigating, I think, is well advised. If they find out that there's nothing going on, then in that case you will have checked. So my advice to you would be to visit an orthopedic surgeon, have them examine, have them investigate, and then if it's something that needs to be sorted out, then that would be a good opportunity to do that.
Here's another one saying, can you advise how best to manage flat foot to avoid future back pain? Secondly, is there a relationship between non-straight finger and neurological issue?
So the first one is about flat feet. So it depends on how you get it. Some you get it as a child. I'll start with children because I'm more inclined to dealing with children than adults. So we see a lot of children with flat feet. And what's been prognosticated now is that maybe we're getting our children to wear shoes earlier than we did before. The reason that is important is that by walking barefoot, then you develop sensory and motor feedback to the brain. Now, to be able to maintain the posture of the foot, which is the curve on the inner side of the foot, requires the muscles to be able to hold the foot up. This happens when it's painless and it's flexible in a child. But sometimes it's not flexible. It's just flat and you can't make it, you can't replicate the curve on the foot. Those ones are associated with abnormal bony anatomy on the foot. So then seeing a pediatric orthopedic surgeon who can examine and determine is it flexible or non-flexible would then have the child having x-rays if it's non-flexible to figure out what's the primary thing. Sometimes it just means there's a fusion in the joints in the foot or an extra bone or an abnormal orientation of the bone like a congenital vertical talus. If it's flexible and painless in children, sometimes it resolves as the child is growing up, so that by the time they're 6 to 8 years of age, they've recreated the arch. But some people still have a flat foot even after that, into their adulthood. Almost 40% of the population has flat feet. 40 is almost half. It will be painless, it will be asymptomatic, it just means it's a different orientation of the foot. As long as it does not change how you put weight on the ankle, usually people live with it near normal without any symptomatology. The issue becomes if then it's making you walk on the inner side of your ankle, then we need to look at that and find either shoe modifications. Some need even surgery on the foot to correct that. Again, as I say, the ankle, the knee, the hip, and the back are all associated. So changing the mechanics on any of those joints could then give you pain on the adjacent joints going up. Please remind me what the second question was.
Yes, the second question was, is there any relationship between non-straight finger and neurological issue?
Okay. So yes and no. Some people just have a non-straight finger. Fancy scientific word is a camptodactyly. It just means you cannot straighten your finger completely. But also, you could have things like trigger fingers. where either initially you have to force the digit to go straight, or sometimes when it gets more severe, you can't move it at all. So the trigger finger, which could make your hand not go straight, could be associated with neurology. There are other things that could make your finger not go straight, like Dupuytren's contracture. It just means you have tightness in the tendons and areas around the joint. Those are associated with neurology. Diabetes is a common cause of that. Or you could have a nerve injury that gives you an inability to straighten your finger. So there are multiple causes, some neurological, some are congenital, you're born with, some are traumatic, you injured your joint and then it's healed in a bent position. So it really depends on what the primary cause is. Yeah.
Thank you. There is this listener here who says, I now look at some of the comments here on Facebook, very interesting. And Onyango, Janam Ward Shikuku, that's what you've written there. You say, Salam to Daktari, the host and listeners. Thank you. You're tuning in, yes, tuning in from Juja, Kiambu. You say you're in the field of architecture. And you say, and we often have discussions on house designs in Nairobi not giving residents access to enough sunlight. As we discuss muscles and bones, might Daktari discuss the importance of getting enough sunlight to aid bone and muscle development?
Okay. So the sun helps us with getting vitamin D in our bodies, and that in extent helps with the calcium production in our bodies. Those two things are very important in muscle and bone development, especially in children. So you'll find children who have rickets, which means you just have a deficiency in calcium and vitamin D. You could get it from diet, but the body also produces calcium and vitamin D. But sunlight is a big contributor to production of your calcium and vitamin D, which impacts the strength of your bone and the muscles. Now, with urbanization, we have higher skyscrapers, less smaller and smaller windows, which bring out less and less rays of sunlight. We have change in lifestyle where children are not playing outside as much. Neither are adults. We're only inside or driving from one place to another, or in a house. Having said that, I think there's a lot of move now to urban developments, including lots of green spaces and play areas for children and green spaces where adults can sit down. So it is important, and there is that overlap. What we do recommend is 9 to 11 sunlight in the morning. It's not scorching to give you issues with your skin. So we'd recommend for parents, especially, to have their children out between 9 and 11 in the morning, because the sun is not too hot at that time. They get in the sun rays, sunlight in, and it helps with vitamin D and calcium, and by extension with the muscle and bone. Yeah.
All right. Another question here from a listener who says, thanks for the session. When I sit for extended hours, my chest pains or experiences pains, and it feels like it is folded inwards, so I have to stand to stretch it outwards. Anyone around me hears a sound like a crack when I stretch out. What could be the remedy, or what could be the problem? Then look at the remedy then.
So we have snapping around joints. So that's the most common thing. A lot of the times it's not associated with anything. It just means you're readjusting the bones and muscles around your joints. As long as it does not give you symptomatology that affects your function, then you shouldn't be worried about it. If the chest pain is severe and affecting your function, then definitely we'll have to look into it. Again, there are many organs around the chest, both on the outside from a bony perspective, but then inside we have the lungs, we have the heart, who have big vessels going about, but those would typically not give you the snapping symptoms that you're having. So it really depends on how bad it affects your day-to-day function. If it's mild, then I would just observe it. If it's a big concern, then I would definitely seek medical advice. Yeah.
All right. Excuse me. There is another question here coming from this listener who says, my 9-year-old son occasionally complains about back pain when he bends. And I find it very shocking since he doesn't do even a quarter of the chores I do. Why would that be?
So as we said, activity helps with muscle resilience. So when you say he doesn't do a quarter of the chores that you do, I get the impression that he's not moving about as much. So encouraging our children to be involved with chores, to be involved with activity, to keep them active in the homes, come up with programs that they can engage with is very helpful. Because as we said, any sedentary lifestyle leads to weakness because of disuse of the muscle, which then gives you pathology. However, it's easy to point a finger to sedentary lifestyle. So again, having your child assessed by a medical expert, a doctor, would be very helpful. But otherwise, keeping them active to build resilience in the muscles is very important. Yeah.
Right. Here's a lady in her early 20s saying, I sometimes have knee pain, waist pain, and asking what could be the problem.
Yeah. So in a young age group, muscular pain is a very common cause of waist pain if you're focusing on the back. As I said, there are nerves that supply the hip and pelvic area that also supply the thigh and down to the knee. So sometimes it could be that it's a pelvic or hip problem that is showing itself referred pain on the knee. So getting a proper assessment as a 20-year-old female is important, because if you're having waist pain, we need to rule out also gynecological conditions, in addition to the orthopedic conditions that we are discussing today. So getting a proper assessment would then help with determining which of those that we're dealing with. But if I was focusing on just the orthopedic side of things, then muscular pain would be the most common cause of low back pain that's radiating down to your knee. Of course, there could be many other pathologies in the hip, in the back, in the lower back, in the knee itself. So us investigating further would help us help you figure out exactly what's going on. Yeah.
A wide array of questions here.
Yeah.
And we'll still look at them.
Yeah.
Here's another question from a listener who says, I have a chest problem too. The more I talk, it clogs. My voice becomes hoarse, and I do have short breath.
Okay.
Probably we'll look at that, and then there are other questions there that she's also asking.
So hoarseness of voice points me towards your vocal cords. So it's important to look at that, because then if you have a change in your voice, then it could be possible that the vocal cords are the ones that are giving you trouble. When you have shortness of breath, it could be even lower than that in your respiratory tract system to involve the chest. So again, seeing a doctor to investigate your chest would help to determine, are we dealing with something that's in the chest that's giving you shortness of breath, or is it something in the upper respiratory system that is giving you the change in the voices and in the voice and your shortness of breath. So vocal cord or something in the chest. Yeah.
Then goes on to say, my right arm tingles and sometimes aches from the right side of the neck to my fingers.
So that's something we call cervical myelopathy. It basically works the same way as the back pain. So the nerves from the cord that are coming to the arm come from the spinal cord at the level of the neck. So a lot of the times, if you have neck pain that's radiating up to the fingers, then that's more often than not where the problem is starting from. So doing an investigation to figure out what is happening on the neck, and a nerve exam would be important to isolate what level and determine what kind of management that you need. Yeah.
And this particular listener says she's on hypertension pills.
Okay.
And says, if I miss to swallow the pill, I cannot recite the arm ache. See, cannot recite that. Yeah, that's where she's at. Yeah, she's 53 years old.
Okay.
Yeah.
So, an easy way of understanding hypertension is you have issues with your vessels. So your blood is struggling to pump. Your vessels are struggling to push through blood into the system. A practical example is if you have a hose pipe and you put your finger on part of it, so then whatever is coming out comes out with a very high pressure. So that can put stress on even the nerves, and it's common, just like diabetes, to have neuropathic insult to your nerves also. As you control the blood pressure and you're reducing the amount of pressure that's going through your vessels, then you reduce the amount of damage that's happening in the nerves. So that would explain why, when your blood pressure is not well controlled, then your symptoms are worse. So with things like blood pressure, then proper control and compliance to medication is very important. Yeah.
Let's look at this one here. I feel a lot of pain on my knees, especially when I sit in a matatu with folded legs. I'm almost 52.
Okay. So the sitting position puts quite some stress on the knee. Again, matatu is a common commuting mechanism for most of us. So again, choosing where you sit, where you can stretch out your leg, is very important. It could be things like just aging of the joint. It could be stress on the muscles around the joint. A lot of those usually improve with change in posture and stretching and strengthening exercises of the muscles that are involved with that motion. So on the top part of your thigh, we have the quadriceps, the quads. So strengthening those muscles helps significantly with improving anterior knee pain, which is very common in the seated position, like you would do in a matatu. Yeah.
Right. Let's look at one more, then do a conclusion of the subject that we were handling tonight for the sake of the listener who probably has joined us along the way. This is from Maggie. Maggie says, my son has a hard, dark, grayish swelling on the upper part of the lower foot, near the toes. He's had it for some time now. Says it's causing pain and causing a limp. What's the best form of treatment? He's 30 years old.
Okay. Yeah. So for a swelling that's been there that is dark and causing pain, it would be important to figure out exactly what type of swelling it is. So getting a clinical exam is a good place to start. Sometimes for swelling, we take a little bit of it, take it to the lab, and figure out exactly the cells that are involved. And that then guides the type of treatment that is needed. So seeing a doctor to assess. Some are benign, you don't even need a sample of tissue, which is a biopsy. But just having somebody have a look at it clinically and determine if it's something that needs a biopsy would help. Yeah.
So tonight we had a very, very insightful conversation revolving around PSOAS syndrome, and Dr. Chelsea has really helped us just unravel the mystery behind it. And so in conclusion, for somebody who has joined us, what's that important message you want the listener to take away regarding PSOAS syndrome?
So PSOAS syndrome is a rare injury to the iliopsoas muscle. The people who are most predisposed to it are athletes or people who commonly do bending motion around the hip. So if you're seated for a long period of time in your workplace, then you're highly predisposed. A lot of the times it would resolve with conservative management, be it use of anti-inflammatories, be it use of a home exercise program that helps with building strength and stretching out the muscle, ensuring that we have a healthy, active lifestyle is important to prevent it. And only few people will need surgery for it. A lot of the times it would resolve with non-surgical intervention. It could be associated with other things, so it's important to not self-diagnose, but see a health expert to be able to differentiate it from the other things that could mimic a PSOAS syndrome. Yeah.
Where can this listener who is receiving us right now find more information or resources about PSOAS syndrome and its treatment, if there is a place, a public place that they can? Yeah.
We are lucky to be in the internet era. And a lot of people have invested in easy patient education articles and sites. So if you just go on your Google search button and Google PSOAS syndrome patient education, you'll be able to get reference materials on what it is, how it presents, common management symptoms. Of course, because it's a patient education platform, they'll try and break it down to a language that you understand, but also seeking medical attention and seeing a doctor to get a thorough examination and investigation is important. Yeah.
Now, as we conclude, we want to wish you a Merry Christmas. It's
yeah, we're in the festive season. Yes, indeed.
Yeah, it's we're counting down maybe 29 days or 28. I don't know, but we are looking forward to that.
Absolutely.
Yes, probably somebody who would like to get in touch with AICQ International. How would you guide them?
We have a website where you can find our contact details. So www.cure.org. We are part of a network of hospitals here in Kenya, but also in the rest of the continent. So we have all our information on our website. Please feel free to check us out. We also have social media. So we are on Facebook, we're on Instagram. So just look out for Cure Kenya. Yeah.
Your parting shot for us, something that you'd like to leave us with this night.
May God bless you, and I wish you a Merry Christmas and a Happy New Year.
You too. Thank you so much for coming. It's been an insightful session, and send our love to your friends there at AICQ. Tell them that they are a blessing to us as well.
Thank you very much. Yes. Thank you so much for having me.
You're most welcome. All right. Tonight we hosted Dr. Chelsea Shikuku from AICQ International. She's an orthopedic surgeon, and I can tell you we have learned a lot from the interaction that we've had with her tonight. Looking forward to hosting her one of these other fine days to have more insights on matters regarding the health of our bones. Well, coming up in the next hour, we have...